Catherine. I'm the administrator of the Spartan facility here, the hospital and the clinic, also the Toma practice. We have a large family medicine practice in Toma, Prairie du Chien, as well as Waukon, Iowa. So I make the circuit a little bit and can do that because I have a very strong bench of my leadership team. And that's something I also want to talk about today. Healthcare is a huge economic driver in our community, and I'm going to show you some numbers around that. But our biggest asset are our people. And I can't underestimate that at all. 70% of our operating expenses are people. We provide health care to people at their most vulnerable. They need to trust us. They need to be able to have confidence in us. And that means that we need to have people who are competent, caring, and know their stuff, and look at you as a person, not just as another patient. So as we talk about this, keep that in mind as a backdrop. That's, turn it the right way, it will work. There we go. So we are part of the foremost medical institution in the country. Mayo Clinic is located in Rochester. Florida and Arizona are also part of the Mayo Clinic, but then in the rest of the Midwest, there's this organization called Mayo Clinic Health System. That is part of what we are looking at. Let me just back up here. This is Mayo Clinic Health System, and the red circle on the bottom is Southwest Wisconsin. It includes Sparta and Toma, and you can see that Sparta and Toma are the eastern seaboard of our organization. Is that me shaking, or is the screen? Is it? Okay. Wow, I didn't think I was that nervous. Sparta and Toma are the eastern, what I call the eastern seaboard of Mayo Clinic Health System. And we are two of the 60 sites that Mayo has in the Midwest. We are part of an organization that is ranked #1 in more specialties than any other health system in the country. You can see, we all know Mayo Clinic's reputation, not only for care, but the research that we do that prevents disease. I don't know how many of you know that there's a new test out there for colon cancer, the Cologuard test, that was discovered by Mayo Clinic researchers that's actually manufactured in Madison. This particular test, I would be my physicians would chastise me if I forgot to mention that March is Colon Cancer Awareness Month, and if you're over 50 and you haven't had your colonoscopy, you should be thinking about that. But there are alternative ways to do this, cheaper, less invasive, and Mayo has discovered those, and they are now on the market for you. They are reducing the cost of care, improving the detection rates, and much more accurate. Mayo Clinic is part of that work and partnering with others in Wisconsin to make that available to patients. So when we talk about Sparta and Toma, I've been with Mayo Clinic Health System about a little over 7 years, and we embarked on a journey to exceptional. And really our goal was, we don't strive to do it all because we're a small critical access hospital. We're a small rural health clinic. We have about 230 employees, but what we do, we wanted to be exceptional at it. So we have what we call anchor services, and if you look at this, this is really our clinic, our primary care clinic, our acute inpatient unit or transitional care unit, where we really do take care of acutely ill patients, but very complex medical patients that come to us from other organizations. We also do 24/7 emergency care that's physician staffed, and we do quite a few outpatient surgeries. Some of your basics are cataracts, hernias, gallbladders, colonoscopies, those kinds of things. There are a lot of people in our community that I'm surprised don't know that we do all of these things here in Sparta. So as we talk about investing in the economic infrastructure, earlier they talked about education being one of the key drivers for economic issues. Employers are saying that. In a recent survey of Wisconsin employers, these are the top drivers, healthcare being the second one, education being the first. So you're spot on for the conversation today. And then I'm going to talk a little bit later about the workforce training and development, because again, 70% of our costs are people. And so we need people who are well-trained and ongoing trained because of the continuing changing technology. A couple of other key things as we talk about the economic infrastructure here in Monroe County as it relates to healthcare. We've reinvested over $15 million of capital in our Monroe County sites between Sparta and Toma. We provide in an annual period over almost $2 million in uncompensated care. This is care we provide that we don't get paid for, that we can track. There's a lot of it that we can't track. And then we've also expanded our services, becoming a destination for healthcare. And as we talk about that, you can see the lines here between the Rochester sites and the Sparta site. We've created some programs in the last 6 years that have created Monroe County as a destination for care. We have patients that come to us and are referred to us from Rochester, La Crosse, specifically patients who are looking to get as close to home as they possibly can for their recoveries. And we have a relationship with Rochester that patients are sent to us to recover. We recruit them and then we transition them back into their regular lifestyle. This is a niche program for us. It has caused us to grow by over 100% of our inpatient services. We've added staff, and financially it has been very beneficial for us to support all of those other things that we've been doing. This is a quote from one of our patients who actually stayed in our inpatient unit, our transitional care unit, and I'm just going to read it so everybody can appreciate his thoughts. I've been in the grocery business my entire life, so I know a thing or two about customer service. You don't get service like that in many hospitals. It was the same with the team visits, and this is something unique that we do here in Sparta. Probably 10 people, doctors, nurses, therapists, and others would gather in my room to discuss my progress and the concerns that I had. Those happen on a regular basis with our patients. The physicians come in, the staff surrounding them, they call them core rounds. This is something that now has been adopted throughout the entire Mayo Clinic health system with these types of services. The Spartan Transitional Care Unit is a gem for people in this region. And this was a quote from the late Bill Quillen. He had had surgery in Rochester. He needed some long-term recovery time that was very complex. He still needed significant medical care, and we were the right place for him at the right time. And as a result of that, he was very generous in helping us remodel our unit, and we're very grateful for his continued his support and his family's support. So I'm going to get into some of the numbers. I want to talk a little bit about the economy of healthcare. The AMA recently did a study, and they look at by physician, and each physician in the state of Wisconsin, primary care physician, supports 10 jobs. Now these are their jobs, their nursing staff's jobs, the jobs of the people who support them, but also the downstream jobs of people in the community surrounding that healthcare organization. So this is the groups of people in the community that we do business with as a healthcare provider and an employer. That each physician represents wages and benefits totaling $854,000 a year, and each physician generates almost $60,000 in state and local taxes. So when you bring that to a local level, here in Monroe County, we have 21 Mayo Clinic health system primary care providers that practice nowhere but here, between our Sparta and Toma sites. So if you just do the math, that supports 210 FTEs. Currently, in our sites, we have 315 jobs. We have about 230 in Sparta, and we have about another 85 in our Toma practice. Those 21 physicians provide $20 million in annual wages and benefits. That's probably an underestimation because we also have 8 other providers that are not physicians that see patients in our Toma and Sparta sites. And we have 15 or so specialists who do outreach to our practices, do surgeries in our suites, they do cardiology work, all of those kinds of things. So this is an underestimation. But essentially, when we talk about the people who work in Sparta and Toma, we're paying out over $24 million in wages and benefits into this community. That also generates over $1.2 million in state and local taxes annually. So as we talk about some of the jobs and the education needs of our workforce, because that's really important for us, clearly, these are good jobs. These are some of the jobs that we have in the midpoint of the wage. And you can see that for most of these are 4-year, if not 6-year degrees, but there are a number of them that are doctoral degrees. The bottom 2 are doctoral degrees. Pharmacists and physical therapists today need to be doctoral prepared. So education is a huge issue for us, not only for our employees as they prepare, but for their children when they come to work in our communities. So as we talk about the total economic impact of the Spartan Hospital, the UW Extension and the Hospital Association did an analysis of this. They ran some formulas, and essentially what they came up with is that Spartan Hospital has a $24 million economic impact just in the Sparta area. This doesn't include what we do in Toma. So that's a significant impact in our Monroe County community. The other thing that is a bit of a surprise to folks is, well, we're a nonprofit organization, and what nonprofit really means is that we don't take anything we have left over after our operating expense and pay it out to shareholders. We reinvest that. So I mentioned earlier, we've reinvested $15 million in our facilities and our services in the last 5 years. We take our money and we have to reinvest it in providing better services and improving and staying on top of what's going on in the changing healthcare environment. But we do pay taxes. We do pay property taxes, and in 2014, Franciscan Healthcare as a whole, which is that entire region with the red circle that I showed you earlier, paid almost $20 million in taxes. You may recall this article that was in the La Crosse Tribune not so long ago about healthy hospitals make healthy communities. This is true. While Mayo Clinic Health System is a world-class organization, it is very important that we have healthy local community hospitals for lots of reasons. Access to care, convenience to care, essential services, business partners in the community. So we firmly believe that, and we've really been able to solidify that in the Sparta community, especially with our hospital there. So I'm going to get into a little bit more of the meat of what I wanted to present, and I know I'm running out of time here, so I'm going to speed this up. As I mentioned, over 70% of our operating costs are salaries and benefits, and we have the other piece of this, and part of our key, I mentioned that I have a really deep bench in our leadership group. We have some of the highest employee engagement and satisfaction scores in the system. We know directly that our patient experience and our patient satisfaction scores are directly linked to the satisfaction of our employees. Engagement scores are also linked to recruitment ability and retention ability. We use things called shared decision making, where we have physicians, administration, and nursing sharing in the decisions. We're a physician-led organization, but there's a different lens in which we all bring to a decision. We share that decision making. We have a recognition program that really works hard to identify our values. We hire people that have consistent values for our organization, and it's a performance expectation. So we really try to find people doing things in real life, in real time, and give them recognition for our values in practice. We also use a lean management system that is frontline problem solving. Again, earlier they talked about teaching kids critical thinking skills. This is key to the improvements that we've had and to what we're trying to do to transform healthcare. We are doing frontline problem solving on a daily basis in our organization to try to figure out how do we reduce our costs, how do we improve our quality, how do we improve our service. As leaders, we're required to do 80 hours of ongoing training a year at a minimum. We make a strong investment in our staff. We do behavioral-based interviewing to make sure we're recruiting the right candidates, and then we reinvest in our people. Our crucial conversations training, again, it's about relationships. So our crucial conversations training is actually a whole day a month for a year. It's a significant investment in teaching people skills and how to relate to each other in the workplace, solve problems, and stay in a trusting environment, because our patients' care is what's at risk. So some of the outcomes of this, employee engagement, again, I can't stress that enough. Our engagement scores in Monroe County are at 98%. We were named as one of the top 20 critical access hospitals in the country, not a top 100, one of the top 20 critical access hospitals in the country for quality. Top 10 percentile for culture of safety, meaning that if you have a physician and a nurse standing side by side and there's something that's going to happen that might harm the patient, that nurse or that rad tech or that medical technologist is comfortable to say, hey, are we sure that this is what we want to do with this? That takes a lot for someone to stand up to a very well-schooled, very confident physician to say, hey, let's stop and let's rethink what we're going to do here today. That means you have to have a strong culture of safety. We've also been named in the top 10% in the country for patient satisfaction. And as we talked about earlier, sustainability. We've been in the community for 100 years. We celebrated our 100th year last summer, and we're very honored to have the Franciscan Sisters of Perpetual Adoration, who are our sponsors, and Bishop Callahan in attendance. Our biggest challenge right now is transitioning from volume to value. Right now we get paid. The more patients we see, the more we get paid. We need to figure out how to provide greater value for our patients because this is moving to being paid for value. And we have to demonstrate that. So we're doing some telemedicine work. We're doing online messaging with doctors' offices. We have a nurse line where you can call and be triaged to see if you really do need to be seen. We're looking at and we're beginning to trial advanced clinic visits with advanced trained nurses for, say, your high blood pressure. Do you need to see the doctor every time or can you see the doctor every other time? We have social workers in our practice. So we've gone through our emergency room data, which all of you know is the most expensive place you can access healthcare. And we have had patients in our community who use the emergency room more than 40 times a year. We need to figure out how to get those folks connected with a physician, with a relationship, and back in their doctor's offices. We're doing that by putting a social worker in our practice and trying to figure out how do we deal with those social issues as well as the medical issues. We also have pharmacists that are in our practice on a schedule, seeing patients to try to figure out how do we best manage the multiple medications that many of our patients are on. And then what we will be doing very soon are e-visits. We currently do e-consults so that you can have a consult with a Rochester physician from the Sparta office. Our physicians can do that consult today, but we're really looking at doing something different with e-visits. So this is some photos of, actually I think Representative Vandermeer is right down here in the corner with Lieutenant Governor Kleefisch. We've had some visitors, multiple visitors, come see the demonstration of telemedicine. And what you're seeing in the upper corner is a patient having a neurological exam with a physician on the screen in Rochester. Time is brain in the case of a stroke. If you don't get certain medications within 3 hours of having a stroke, you will have a poorer outcome. This technology is improving the health outcomes of the patients in our community. If you don't get that treatment within 3 hours, which is going to take you, by the time you get in, get assessed, and then get transferred somewhere else, you're going to lose that 3 hours. So we can do it right here in Sparta now. Another thing, we talk about our lean management system. This is an old picture of a very immature visual management board, but these have changed pretty significantly, but the core is here. We have 5 key performance indicators of what we're trying to measure as our success, and our staff do frontline problem solving. So you can see what are our outcomes over time that we're trying to accomplish, what are our key drivers, and what are the A3s, if any of you are familiar with lean technology, or lean terminology, what are the A3s that you're working on and problems you're trying to solve. So almost on the home edge here, recruitment and retention are our issues. Physicians are hard to recruit, 5% of them want to practice in rural areas. Nursing shortage, we're working with nursing training programs. Last week we had a bunch of kids from the Sparta High School come, very excited. We were excited to have them and show them what healthcare careers are about. If any of you are in education and you want to do that, we'd love to have you. My card's on the back table by the Mayo booth. The other issue that's important for us is spousal employment opportunities. This is one of our biggest challenges in recruiting, is not only finding a spot for the professional, but finding a spot for their professional spouse that may not be in healthcare. A couple other quotes from our patients. I can get care anywhere. When we come to you, we're greeted with warm smiles and we're welcomed. You saved my life, again. Thank you for being compassionate and not giving up on me and figuring out what was wrong with me. That's probably one of the biggest claims to fame of Mayo. When people can't figure out what's wrong with you, they send you to Mayo. Mayo inspires hope and trust. And that's what we're doing here in our Sparta community. So we're very proud to be part of that organization, very proud to be bringing Mayo-level care to Monroe County. Here's a couple things to leave you with. We employ over 300 people with good jobs and good benefits. We make Monroe County a destination. We contribute to the tax base. We have an economic impact of $26 million. We provide uncompensated care. We reinvest. and we're innovating to reduce the total cost of care. But always, always, the needs of the patient come first. Thank you.